Before you drink warm water and salt to treat your sore throat, please listen to this. Sore throat can be caused by various germs, but sore throat caused by a particular group of bacteria called the group A streptococci can lead to what we call acute rheumatic fever. Acute rheumatic fever is a disease that typically occurs about 2 to 4 weeks following sore throat infection caused by this group of bacteria called the group A streptococci. Typical symptoms of acute rheumatic fever include arthritis, so joint inflammation, and typical joints that are affected are large joints like the elbows, the knees, the wrist. It has a characteristic pattern because usually it feels like the joint pains are migratory. What do I mean? Means like you feel pain in one joint, and after a few days to a week, the joint feels almost normal, and then you start feeling pain in the next joint. Other symptoms include rashes underneath the skin called subcutaneous nodules. You can have typical rash called erythema marginatum, whereby there's a reddish kind of rash where it moves from one body part to the other. There are other serious symptoms of acute rheumatic fever such as chorea, so it's kind of involuntary movement. But a major complication of acute rheumatic fever is what we call carditis. Carditis is kind of inflammation within the heart valves, and this is the feared complication of acute rheumatic fever. Who would have thought sore throat leading to heart disease? Acute rheumatic fever actually is the leading cause of death from cardiovascular causes within the first 5 decades of life in low and middle income countries. Therefore, it is not something to be taken lightly. Poverty, overcrowding are some of the risk factors for acute rheumatic fever. Acute rheumatic fever can be prevented, and prevention is typically by effectively treating sore throat caused by this group A streptococci. And the only way to do this is to seek medical care when you've got a sore throat, because your doctor is going to do tests and prescribe antibiotics, because proper antibiotic therapy for group A streptococci infection of the throat would reduce the incidence of acute rheumatic fever. Before you drink warm water and salt to treat your sore throat, it's important to think about this. What will be the long-term complications if this was a group A streptococcal infection of your throat? Few years down the line, maybe you start going down with maybe a cardiovascular disease, which could have been prevented just by effective antibiotic therapy. So think about that before you go on doing self-therapy at home. So if you found this video helpful, why not give me a like, follow me, and stay tuned for more updates like this. Thank you.